Well, good morning. I'm Dr. Rick Olson from the Office of Disease Prevention and Health Promotion at HHS, and I'd like to welcome everybody to our workshop today. I'd like to start off, I'm going to show a brief video of Dr. Brett Giroir, who is the Assistant Secretary for Health at the Department of Health and Human Services. Dr. Giroir was planning on being here today, but was asked by the department to go to a meeting at the United Nations this week in New York City, so was not able to be here, but he did a short video that I'll show in just a second. Dr. Giroir is the principal advisor to the Secretary on Public Health and Science, and leads several offices that deal with or key offices that deal with public health in the country. Some of those include disease prevention and health promotion, minority health, women's health, human subject protections, areas like that. He also deals with infectious disease and vaccine policy. He leads 3 presidential advisory committees and 11 secretarial advisory committees, and he also oversees the Office of the U.S. Surgeon General. Dr. Giroir also is, I'm sorry, I've got the slides. There you go. Dr. Giroir also leads the nation's issue related to the opioid crisis, as well as the department's new initiative to deal with the HIV epidemic. You can see he's in a uniform. Dr. Giroir is basically the head of the Public Health Service. The Surgeon General works for him, and Dr. Giroir is the only O10 or 4-star Admiral in the Public Health Service. Previously, Dr. Giroir has served in numerous leadership positions, both in government and in academic institutions. He trained as a pediatric clinical care physician and has cared for critically ill children for about 14 years before he went into more administrative types of functions. He's authored or co-authored almost 100 peer-reviewed scientific articles and has numerous patents on biomedical inventions. He also has received many awards and honors, and I'll just name a few. Won the Secretary of Defense's Medal for Outstanding Public Service, the American Heart Association Lyndon B. Johnson Research Award, and also the Society of Critical Care Medicine Annual Scientific Award. So I'll show the video here now. Oops. It's not working.
Good morning, and thank you, Dr. Olson. I'm sorry that I couldn't be there today to participate in this workshop about brain health, a topic that is very important to me and should be important to all of us. First off, I want to thank the Planning Committee and the workshop speakers for your time and contributions to the field. I know that we will all gain valuable insights from the discussions that occurred during this meeting. Advancing our understanding of brain health will improve both longevity and quality of life for patients and for families. Even partially effective prevention or treatment strategies could affect millions of Americans because brain health affects Americans across all ages, races, and ethnicities, both men and women. For example, a CDC estimate is that as many as 5 million Americans were living with Alzheimer's disease in 2014. That same year, over 800,000 children were treated for concussion or traumatic brain injuries in U.S. emergency departments. And each year, more than 795,000 Americans have a stroke in the United States. I ask you, who in this room has not been impacted, either personally or through a family member, by brain injury or brain health? I know that I have been affected in my personal life, and so many of my children patients who suffered traumatic or anoxic brain injury, whom I treated every day. These are just a few examples. Examining brain health isn't focused exclusively on disease, disorders, and vulnerability. It is critical to study and understand the ways our brains grow, the ways our brains learn, adapt, and heal. HHS tackles issues related to brain health through our work in many different offices, including several projects within my office, the Office of the Assistant Secretary for Health. Dr. Olson will elaborate on these projects shortly, but the focus of today's workshop examines brain health from the 10,000-foot level. You'll be looking to define terms we so often use, like brain health and resilience, and identify key elements to measure these terms. You'll hear from experts about optimizing brain health and describing brain-body interactions, and hear how brain health is related to behavior, to biology, to society. The report developed from this workshop will serve as an important step to increasing our understanding of how the brain develops and changes throughout the lifespan. Just as discussions on brain health shouldn't focus exclusively on disease, your conversations should not be constrained only to the domain of public health. It is critical that professionals from different areas, including researchers, healthcare providers, mental health experts, the business community, educators, first responders, military, law enforcement personnel, athletes, and others join the conversation about brain health and take actions to promote the improvement of brain health for all Americans. HHS will work with the National Academies to host a companion workshop focused on bringing these voices to the table and outlining ways that key sectors of society can apply the latest scientific evidence and educate the public about brain health. Thank you again for your expertise and your time. Collectively, the knowledge shared from each of your perspectives will contribute to the body of scientific knowledge around brain health and cognitive ability. Using this information, we can help ensure that America is positioned to lead the world in advancing science, policies, and programs to improve brain health across the age spectrum, from premature infants to octogenarians. I am so excited to be able to sponsor this workshop and learn about all the new, exciting opportunities that we can seize together. Thank you. Good morning.
There you go. As Dr. Giroir mentioned, obviously lots of HHS agencies and offices deal with various aspects of brain health. I'll talk just a few minutes about things that we in our office do, the Office of Disease Prevention and Health Promotion, which is one of Dr. Giroir's offices. I'll talk a little bit about the Healthy Aging Initiative, the Physical Activity Guidelines for Americans, the Dietary Guidelines for Americans, and a little bit about aging efforts that we've undertaken. There you go. Healthy People has been around for many decades. Folks probably are aware of it. For the past 40 years or so, Healthy People has developed goals and objectives to improve the health of the country. It's basically a roadmap for health promotion and disease prevention in the country. There have been a bunch of brain health objectives and goals over time for Healthy People 2020. They've looked at issues such as traumatic brain injury, suicide, depression, substance use disorder, treatment of individuals with serious mental illness, dementia, and cognitive decline, as well as developmental screening. There you go, okay. The Physical Activity Guidelines, we released the second edition of Physical Activity Guidelines last November at the American Heart Association meeting. We had a 2018 Physical Activity Advisory Committee that helped us develop the science base for this policy. The physical activity guidelines provides evidence-based guidance to physical activity, to fitness, to health, and to prevention of chronic diseases. Habitual physical activity has a lot of very positive impacts, and the Physical Activity Guidelines Advisory Committee showed that habitual physical activity reduces the symptoms of anxiety and depression, can reduce the risk of developing depression, can reduce the risk of developing dementia, and obviously can help us sleep better. Individuals who do habitual physical activity can usually report having better quality of life. There are some positive effects from acute physical activity as well. I think folks are aware of this. The increased cognition, aspects of cognition for youth, and decreasing anxiety in adults. There you go. The dietary guidelines is another policy that our office puts out, and we do that every 5 years as the nutrition science evolves. We currently have a 2020 Dietary Guidelines Advisory Committee. They're looking at various aspects that do look at brain health as well. They're looking at various dietary patterns that consumed at each stage of life in relationship to neurocognitive development and health. And in addition to these policy developments, our office deals with healthy aging. We co-hosted a Healthy Aging Summit in 2018 and currently have a series of regional workshops being conducted around the country in anticipation of a Healthy Aging Summit in 2021. So as Dr. Giroir mentioned, information shared today and the consensus from this work group workshop will help our department as we move forward to try to improve the brain health of all Americans. And I'd like to close by just thanking the Planning Committee and the workshop speakers for their time and their expertise today. Thank you.
Yeah, it's a miracle. Thank you. Good morning, everybody. Thank you for being here. I am Huda Akil from the University of Michigan. I'm a member of the organizing committee, and I am delighted to be helping with this session today. I am very grateful to Captain Giroir and the whole funders, the group of funders who have invested in this topic, because I think we can all agree it's a central topic and its time has come. I'm here to sort of frame the discussion a little bit for today and tomorrow, and hopefully then we will have a chance for a lot of audience participation, and I think there might be people online who might also want to participate. So the objectives of our workshop is how do we begin to define brain health and the concept of resilience? What are the key elements and how we go about measuring what we mean by brain health? How do we objectify that in a way that's measurable? And then really, this is a relatively new way of looking at the question. And so what are our research objectives? What should we be asking and answering and funding so that we begin to reframe the conversation in terms of health as opposed to illness all the time? This is the planning committee. I'm sorry that some people couldn't be here just because the timing of the meeting started and they had conflicts, but trust me, they all worked hard on selecting speakers and framing the whole kind of program. So the outline of the workshop are those 4 elements: the brain-body interactions, the convergence between biological and behavioral factors, brain health in the social context, and brain health across the lifespan. And I'm just going to give you a few thoughts of relevance to the broad questions that we are trying to discuss in this meeting. So first of all, I think it's important, those of us who study the brain in various stages and problems have learned to think in terms of multiple scales, to not just think about the brain in isolation, but to think about it in a social context, in a family context, as well as a whole individual context. And so then we think about the brain and then its element parts that are critical to its functioning, including neural circuits, neural cells, and the key elements at the level of the genes and epigenetic modifications that make it up. And we, of course, learn in biology that you start from the genes and you think about how you construct the whole organism. But I think a very important concept is that bidirectional regulation, where each one of these levels modulates all the levels back down, certainly the brain, and all the way down to the gene. And while that was the model for brain disease, it's equally relevant to brain health, where we need to think about positive human interactions, about well-being, not just illness, and the brain and its cell and component parts, and how we work both forward and backwards in order to ensure greater health across all these levels of analysis. So this is the element, the organ we're studying. It's kind of ugly, but it's also very beautiful. It's extremely complex. It has trillions of connections, and it operates via neural network. And there's a whole army of neuroscientists who are studying the brain in a variety of ways and with very cool techniques. This is from my husband and colleague, Dr. Stan Watson. This is a clarified brain, where you're looking at the anatomy of particular cell types, the dopaminergic cell types, projections into the cortex, special cells in the cortex. So you can start taking a trip through the brain in breadth, in depth. You can also study the nature of neurotransmitter and their interconnections. This is from another colleague, Dao and Kai, at the University of Michigan. I'm just using these to tell you they show much better on my screen than they're showing here. But just to tell you that we have many tools, anatomical, molecular, and so on, for studying the brain. But it's the important part here is to think about how we use that information for the greater good. And as was already said, it's important to understand how the brain functions. And this is a very general way of framing the job of the brain. So first of all, it has to control the body. So it's sort of the master manager of the body. That includes itself, it includes the rest of the body, which of course means it has to hear from the body, with hence the importance of brain-body interactions. It needs to monitor the outside world, both its physical context and its social context, hence the importance of physical and social context in how they impact the brain. And then it needs to learn. And that is really a key feature of the brain that is distinctive in some ways. All of our organs adapt and change, but this is the quintessential feature of a mammalian brain, is that it changes physically, and that is part of its function. It's not just a side effect. So these are elements that are going to be very relevant to this whole conversation. But sadly, I would say that nowadays our brains are unhappy with us. And I say that because why would that be? And I would say that that's in part because our health has been impacted by modern society in new ways. And the brain is a major target. Either it's the primary site of those disruptions or it's a target of these disruptions. And how we use our brains has been changed. We live in a more complex, more demanding world. We have many more choices, but we have a lot less predictability. Sometimes we feel we have a lot less control. These elements of lack of predictability, lack of control, are the quintessential definition of what stress is. And so it is very stressful. We're social animals, and the whole structure and functioning of our societies have changed, especially in terms of social support. And we live longer, more complicated life. And I have to tell you, as an old person, the expectations keep rising. You don't just get to just quit thinking somehow. So that requires that we keep that brain healthy for a lot longer. So the question is that our brain have evolved to handle a different life than the one we are living. And how do we compensate? We're not going to turn back the clock on civilization, but how do we become aware of how life has changed and how our brain needs to adapt and help it adapt in a more positive way? And you have already heard that the global burden of brain disorders is huge. And to my mind, that is a manifestation of this disconnect between the way we live and the way our brains have adapted, whether we're talking about mood disorder, suicide rate, childhood disorder, dementia, neurodegenerative diseases, or the opioid epidemic. To my mind, those are all signs that our brains are unhappy with us. And the question is, how do we achieve greater health, both for disease prevention and for just human happiness altogether? So there are some key concepts that, as we go forward, I want to sort of highlight and tee up some questions that we could be discussing. One is our brains are each different, just as our bodies are different. We're not all the same, and there isn't therefore one way to achieve brain health. We all have multiple ways of coping with the world, of learning about the world. We live in multiple contexts and settings. We use multiple tools and strategies for us to survive, and therefore, for us to achieve resilience, if we're going to use that term, we probably need a diversity of approaches. And so the question is, how do we even measure brain health in the context of this kind of diversity? So that's one question. The other is, most of these disorders that I listed are the results of gene and environment interaction. But so that's good. That makes studying them complicated. But the good news is, when you say environment, that means you have an opportunity for prevention, and that we need to take advantage of this opportunity. That opportunity can start very early in life, and we know, for example, an active and rich environment, physical and social, are really important. And the question is, what are the essential features that really matter to promote brain health across different ages and stages? A third concept is resilience. We've used that term already. And some people think being resilient is an intrinsic quality of like a rubber band, right? So you stretch it, comes back. That's called resilience in physics. But resilience, the way we use it in this context, is not just that it's built in. It's not just that you were never vulnerable in the first place. The brain has mechanisms to build resilience, and these are so-called counter-regulatory mechanisms, which means if it is stressed, it develops mechanisms to combat it. This is sort of a yin and yang concept of vulnerability and resilience, not just the absence of it. So some stress is actually good for developing resilience. You don't want to wrap kids in cotton and never let them experience anything and expect them to be tough. They're not going to be. So, but the question is, what is good stress and what is bad stress? How do we handle levels of stress that are handleable, but prevent ongoing chronic stress that contributes to this idea that my colleague Bruce McEwen has termed allostatic load, a lifelong load of stress that starts to cause brain damage. An additional topic that got brought up is the idea of neuroplasticity. We said the brain is a machine that learns, it remodels itself, it has an amazing ability to do that. And this, it should be remembered, is not an ephemeral concept. This is an actual, active process of physical remodeling. New cells get born, new connections get made, branches broaden, actual brain remodeling goes on. But this is not an infinite resource. There is a concept called metaplasticity, which shows that we have limits on how much we can remodel our brain. And if we spend time remodeling our brain because we're coping with opioid addiction, that limits our ability to remodel the brain to cope, say, with depression. And so this idea of good remodeling and bad remodeling, good stress and bad stress, and a limit on how much we can keep remodeling is, I think, something we need to kind of keep in mind. So how do we support good neuroplasticity and use it wisely, then, is a question. And very importantly, a key concept is that this is going on for a long time, as we've already said, but they're not. So, this is the brain that's going to serve us from being babies to being a little old lady, which I'm looking forward to. But, it has to work all along, and it has to adapt to different demands. There is an important concept of critical periods where there are unique opportunities for remodeling. Early life, adolescence, I would say menopause, every time that hormones hit that kind of open up your chromatin, your genes, and allow remodeling is a moment where major rearrangement can happen. And I think it's really important to think about that while at the same time thinking about how you keep the ability of remodeling going for a long, long period. So how to foster and preserve this remodeling capacity across ages. So to my mind, the goal of this multi-scale approach that we talked about, looking up and down, forward and backward, is to make people healthier, to give them the power over their brains and a sense of understanding about the brain and hope that they can cope with it. So that's sort of where I want to go conceptually with you. The expectations is that we're supposed to remember our objectives. We need to come up with some definitions, think about measurements, consider the research gaps. We really want you to participate in this discussion, or participants to email us questions and comment. You'll have some brief questions available, brief periods available for clarification questions, but the bigger questions we will keep for the panel discussions. For the speakers, the staff will hold up reminders, and then this meeting is being recorded. There is a webcast. A rapporteur is going to summarize it, and tomorrow the meeting is in a different room. Thank you.